In order to encourage people to take co-responsibility, to be equal and active participants in their healthcare, we need to be, in the first instance, give them access to their records. And without a knowledge of what's happened to them in hospital or at the GP practice, how do they possibly begin to understand how to manage themselves and their own healthcare? And so the first step was to digitize the records. And that's what we began to consider back in 2018. The reality is that you cannot give patients a doorstopper to read in terms of their hospital records. And we've got to make it easy for them to understand and de-jargonize it. And so digitizing our hospital records was the very first step in getting our doctors and nurses to be digital so that ultimately we could give patients a summary of care. We wanted a solution that allowed doctors and nurses to access the records of the patient away from the bedside. Because normally what happens is you get a call about a patient, you've got to rush to the bedside to read the manual records, whether you're in theatre, whether you're at home, wherever you are. And having access to a mobile platform such as iOS allows you to look at those records in real time, in the comfort of your home, or wherever you are, perhaps at a restaurant or in theatre, and be able to make a clinical decision. And that applies to nurses, to allied health professionals, and to doctors. And it's critical for us. We want that healthcare and those records to be available 24/7, wherever you are.
When we're evaluating electronic medical records, that was actually one of the benefits we were looking from a system, that there was this mobile capability. Historically, there were devices called computer on wheels, which were these big, bulky computers which used to be wheeled around in hospitals, and it just wasn't practical. For this project to be a success, we needed to go mobile first. It was an absolute no-brainer for the group and for me.
The why of the project was extremely important to us. For us, it was really around going around the country, starting off with roadshows, a couple of years even before the project started, to get everyone an understanding of what this digitization journey would involve, what it would entail. So everyone knew exactly what the why of the project was before it actually started.
So iPads delivered uniformity in the user experience, the battery life, the boot times, and the update cadence, meaning less IT overhead for my team. On top of that, the security with iOS is second to none. And based on those factors, it made it quite a clear choice for us that iPad was the most suitable mobile device that we could implement in such a large-scale implementation across our hospital network.
In healthcare and in many environments, time is critical. You don't have time to waste. And when you have 50 patients to see in a day, you want to make sure you're efficient. It was a complete game changer. For the first time, doctors could actually interact with an electronic record and really feel the power and the magnitude of what they had in their hands. It changed how we practice. We started appreciating the technology. We started engaging with it. We embraced it in our day-to-day lives. And that was a really powerful enabler of the future success of care. When we then eventually came back to implementing, things just progressively ramped up. We went to 3 hospitals, we went to 7 hospitals. And then eventually at some points we were implementing up to 9 hospitals concurrently. Prepping one hospital, completing another, and then still entrenching in the maintenance phase of another hospital. And then over the course of a few years, we then completed our 45th hospital in 2024.
So I think the iPad in the hands of a clinical pharmacist was really powerful in terms of giving them so much access to patient information that they had never previously had. It empowered them better on ward rounds with doctors or microbiologists, so that at the click of the button they had all the necessary information they needed in terms of laboratory results, up-to-date medication therapy, how the patient may be responding, to really just guide and advise better medication management and therapy for the patients. So it really helped empower them to contribute more confidently and better within the multidisciplinary team.
This has completely redefined modern healthcare delivery. We don't even know what paper looks like anymore. You go into a hospital where we're so used to seeing this massive ICU chart and the stack of pages in this massive folder, you're trying to find everything. You now walk into an ICU and the table's completely clear. At best, you'll see a single blue cover of an iPad. It's all just that single iPad and all the care happens to that device. The wards look completely different. Our pharmacies were completely different. There's no porter or messenger running with a piece of paper to the pharmacy to go collect the medication and come back urgently. The medication is there at the bedside as soon as you order it. That entire loop has changed. The way we place our orders to our laboratories, our radiology service providers, all of that happens electronically. Yet again, immediately, the time saving is instant, and then ultimately the results are all there at your fingertips.
For the first time, we have this real-time data available, and we are now able to track and effectively measure each step of our dispensing process, and that has really been a game changer for our pharmacy management teams. That the measurement and the availability of the data really helps to plan resource allocation effectively, understand the high demands of when most patients' prescriptions are released, when most patients' prescriptions are leaving pharmacy, and it really helps with the allocation of tasks to improve efficiencies within the pharmacy itself on an operational level.
We were the first in South Africa to get authorization and approval by the Pharmacy Council to put in electronic signatures and scripting. And we've set the gold standard for South Africa. And that means that every script, we've got 1.6 million scripts that are written a year, are done safely and without error.
So nursing is the biggest end user of the system. So I've got more than 20,000 end users currently on the system. And at any given time, we've got more than 4,000 people logging onto the system. We started off with more than 3,000 pieces of paper, went down to about 1,000. Now when we're on CareOn, we're down to less than 100 pieces of paper. I think the goal for us at the end was mobility. We wanted actually to go in and say, you are not restricted to a trolley, you're not restricted to the battery life.
Firstly, we had to reconfigure all of our hospitals to ensure that we had adequate storage and charging stations available. We've got rid of all manual records and paper, and our nurses use the iPads with pride. We've got over 29,000 users of the iPads throughout the organization, and at any one time there are more than 4,500 people using the iPad in real time. We used Candy Crush to introduce our nurses to iPads, and the first 3 or 4 sessions was simply just enjoy the iPad, have fun, learn how to use it, learn how to switch it on, learn what it can do, and that brought a lot of fun to it. And I can tell you, our nurses have embraced the iPads and become the pioneers of digitisation in Africa.
And that didn't stop once we started with the implementation. One of the key elements that contributed to the progress was really ensuring that people got constantly reminded on why we're doing it, and then also sharing the successes of the project. When we talk about culture and people wanting to do more, wanting to improve healthcare, it was important for us to celebrate the achievements at every single hospital. So every single hospital, 45 hospitals, was part of this celebration journey over the past 7 years. This was key to getting us to where we are today.
We've always had a culture of servant leadership, and you can see it in our badges. There are no titles on our badges because we're here to serve society. And we've got to sublimate our ego and be part of that chain of offering compassionate care with dignity to our patients. I think to put this transformation in context, it had never been done on this size and scale, certainly within Africa. And we were rolling out across 45 hospitals, across thousands and thousands of workers. And it was an incredibly complex execution. And we needed a very reliable partner. And we chose iStore, and they came to the party because it was a demanding schedule. We had to roll out at the height of COVID, which had its own challenges when we were treating over 160,000 patients. And we needed the equipment, we needed it serviced, we needed it working in a just-in-time manner. And credit to iStore, they didn't disappoint, and we're delighted with that partnership.
I am just a representation of a wider team of people at iStore Business that collaborated to deliver this project. Sales, technical, operations, and supply chain teams worked cohesively to ensure timely delivery to every single hospital across a 4-year period. iStore Business are absolutely privileged to be a trusted partner.
We have just scratched the surface in terms of digital health. And we are going to use all of this information to empower patients to live healthier for longer, to concentrate on their health span. And so not only are we going to give them their records, we're going to integrate all of their data from their various wearables and be able to give them a holistic view, a digital twin, if you want, of their healthcare and who they are. And we're absolutely committed to doing that across all of our operating divisions.